The health care bill went through its final vote, but the fight is far from over. In fact, it's causing heated debate among parties and people right here at home. Congressman Vern Buchanan just arrived back from Washington, D.C., where he witnessed firsthand the upheaval surrounding this bill. And Congressman Buchanan, I want to start off by talking about exactly what the approval of this bill means for people here on the Suncoast.
Well, there's some good things in the bill in terms of families being able to pay for their children up to 26. That'll be a good thing. Pre-existing conditions is important in terms of the bill. But make no bones about it. I mean, the problem with the bill for this area, it's going to cut Medicare $500 billion. Doctors and senior citizens will be impacted, I believe, and it's going to raise taxes over $500 billion on working families. And the biggest concern I've got, it doesn't do anything to cut cost for working families. They might say that. What this bill does is expand coverage for 30 to 50 million people that are either highly subsidized or it will be free for them. But someone's going to pay for it. So they're expecting it could run as much as $2.5 trillion. And the concern is, yesterday was reported, in fact, in the New York Times, that Social Security, the first time in 20 years, is going to pay out a lot more than it takes in. So Social Security is on the verge of bankruptcy, Medicare is, and here we got another $2.5 trillion bill. We need a reasonable bill that makes sense. There's some good things in this bill, along with the Republicans, got some good things in there, come together on a bipartisan basis. So I think people want to repeal it, but replace it with something that's more common sense and not put our country at financial risk, because we're teetering on a lot of things right now. It's a $1.5 trillion deficit last year. They put together a budget for another $1.5 trillion. We got $13 trillion in debt, 12.5 to 13 trillion. They're expecting 20 trillion in the next 7 years. So we're going to put all these things that veterans and seniors have fought for at risk. And I just think in this environment, it doesn't make sense to pass a bill that's going to be more debt on top of the debt we already have.
And in fact, you're already planning a next step. What is your next step here?
Well, I think what we're going to do is focus on the elections. I mean, it is law. And so we'll focus on the elections and try to get in a position where we can repeal it, but replace it with some common sense, some ideas they've got, which won't be terribly expensive, and some ideas in terms of the Republicans with tort reform, buying associations, buying health care cheaper in terms of a realtor today. I was talking to her. She said her people in her office are paying $2,000 a month for insurance, health care insurance. That's insane. And they're expected it could go up as high as $3,000 in the next 5 or 7 years. It does nothing for the realtors or anybody else. What this does is expand coverage for a lot of people at a time we just can't afford it, unfortunately.
All right. And I know that you actually have a town hall meeting coming up if people want to express what they're feeling about what happened with this bill. When is that?
Yeah, tomorrow. It starts at 11 o'clock in Venice in the community center. The doors open at 10. We'd like to get as many people out and express themselves. There'll be people passionate on both sides. But now that the health care bills have been passed, I like to get their thoughts and ideas, because the general feeling with people, and 75% of the people in this area, I don't think Washington's listening. I want to be there listening, but I can tell you that we want to get that sentiment from our constituents tomorrow.
Okay, all right. Thank you very much, Congressman Buchanan, for your time today.
Thank you, Mia.